Hello everyone and welcome to Rad Chat, founded by me, Julka-Anderson.
And me, Jo McNamara. So Rad Chat is a forward-thinking global knowledge hub where healthcare professionals can advance their expertise in radiotherapy and oncology. Unlike traditional academic resources, we blend real-world experience, expert insights, best practice, and of course, most importantly, patient perspectives.
We make advanced knowledge engaging and accessible, supporting continuous learning and professional development without compromising patient care or personal time. By providing insights into both technical skills and career development, helping you progress confidently in your field and shape your professional future.
Just to let you know, our episodes may contain sensitive and difficult topics that you may find distressing or triggering.
So this is episode 204, which is part of the Living With and Beyond Cancer series, where we will be hearing from our guest, Jess Synge, talking about her experience of cancer and her career in radiation therapy. Hi Jess, how are you?
Hi guys, I'm good, thank you.
Great to have you on. Would you mind just starting and telling us a little bit about yourself for our listeners, please?
Absolutely. So, as Naman has already said, my name is Jess. Was trained as a radiation therapist a number of years ago now. I live in Tauranga in New Zealand, which is the North Island, way down the bottom of the world. I had a lovely long career in radiation therapy, or not long enough. I thought I'd do it forever. And then a few years ago, I actually made a change to working for Elekta, which I haven't looked back from, although I thought I'd be a radiation therapist for the rest of my life. It's been quite a transition. I think, where else was I going to go with that? Yeah, I have got two young boys, 6 and 9 years old, that keep me very busy. What else have I got to tell you about myself? I got into radiation therapy primarily because of my experience with cancer when I was 15. So I was diagnosed with Hodgkin's lymphoma. And then, yeah, that's what propelled me into radiation therapy. And then just last year, just before Christmas, I was diagnosed with breast cancer, which was actually as a side effect of long-term side effect of my past mental radiation. Yeah, I think I've had quite the career in radiation therapy, both as a patient and as a professional. Yeah, a little bit about me.
Thank you so much for sharing.
Yeah.
And we have to say, it is quite impressive that you are our first guest from New Zealand and the time zones we have managed to make work.
I know.
So if anyone's watching this and think, Jo, your eyes are more squinty than usual, it's because it's just turned 7
It's not Jess's accent that she's trying to figure out.
But Jo, you've been so excited about it, you woke up at 4.
Yeah, very excited. I've been giddy about Jess coming on. But Jess, thank you so much about sharing your own personal experiences. And I suppose it must be true testament to the experience that you had that you did then decide to go into oncology, because I would imagine having a cancer diagnosis, for a lot of people, they never want to hear the word cancer ever again. And then to actually decide to go into the profession. What was your initial experience like at the age of 15? Because, I could imagine that's very different maybe to the experience that you've had more recently.
Absolutely. I think that's something that the most recent experience has really given me the opportunity to look back and reflect at that cancer, to put it bluntly. Yeah, 15 years old, and I guess for some perspective, I grew up quite rural, so my parents were dairy farmers. They lived quite far away from where I went to school, so during the week I lived with my grandparents on their farm so that I could get to school, and then the weekend I would go home. And I still vividly remember finding this little lump in my neck and going to school and showing my friends. It just stands out to me, and at the time I thought nothing of it. Never in your wildest dreams do you think this little lump that you're showing to everybody is going to turn out to be cancer. So yeah, I think I look back at that now and I kind of think I really did not ever think that the gravity of the situation really kind of fully absorbed into the 15-year-old Jess, because I think, I was just like, okay, this is just something I have to do, really. And I think when you get a diagnosis and you don't feel unwell at the time, it's just like, this is what you've got. Hearing the word cancer is obviously, yes, very scary. And as a 15-year-old, the first thing I thought about was like, I'm going to lose my hair. The world is ending, And those are the things that I focused on. I was lucky enough that for whatever reason, my hair didn't fall out. So I didn't have that, that aesthetic of being a cancer patient, which, although surface level sounds very awful to say, those are the kinds of things as a 15-year-old that you cared about, because you're going to stand out and look different to everyone. So, very thankful for that. And I think probably more so it was just the side effects of the treatment that it's really hard to kind of compute that when you feel like there's nothing wrong with you. Yeah, so the chemotherapy was horrific. I really don't have many nice things to say about that experience. And then obviously, not that I would ever say radiation therapy is an easier treatment, but from my experience, I coped with it a lot better. With chemo, I had like anticipatory nausea, so I would start, being sick before I even got to the hospital, just with the thought of how I was going to be. And I think radiation therapy, it was the staff and just the level of comfort and care that you just get day in, day out. And it just felt like they were your friends as a 15-year-old. They were just so, maybe it was a little bit awkward. I was quite obviously young and they weren't used to having many young patients where I was treated. I eventually went back and trained as a radiation therapist and worked there. And a lot of the staff have said to me a couple of times, like it was such a novelty when you came in because you were so young and youthful and had all this energy. I was like, oh, well, that's nice to know. But yeah, and in itself was quite an experience going back to work where people knew who I was, because it was only a few years later. Yeah, it was quite interesting. And then lots of conversation, as there were always is with RTs, and what do you want to do when you leave school and all those kinds of things. And at that stage, I just thought, I actually didn't know what I wanted to do. I think I thought I was going to study law and history, and here I am. So yeah, they talked about radiation therapy as a profession and how wonderful it was, and for travel and, the opportunities that there are and the patient interaction, and which obviously I experienced. So it kind of just became a no-brainer for me. Yeah.
Thank you for sharing your honest reflections. I think especially around the body confidence as a teenager, that's quite important to kind of acknowledge. I was just wondering, before you were diagnosed with cancer, did you know much about cancer or radiotherapy?
No, at all. And that's nobody in my family. I think aside from at that point, my dad's grandfather, so my great-grandfather had died of bowel cancer, but that was it. Yeah, no. And even to this day, I'm very few relatives that have been through it. So yeah.
Jess, can you tell us a little bit about your more recent diagnosis and kind of what that experience was like?
Yeah, absolutely. Very different. I was quite fortunate that when I came back, there's a little story to this, I think. When I came back from living in the UK at age of about 25, I came back to work in the department where I had been before and also where I was treated. So I saw my radiation oncologist quite frequently, and he was a colleague by that point. And he just stopped me in the corridor one day and he said to me, I've just been in an MDM and, there's a lot of recommendations for long-term screening for breast cancer for previous Hodgkin's patients. So we're going back quite a few years now. And when I was discharged from oncology with Hodgkin's, there was no long-term follow-up. I had nothing in place. So that was kind of like a real, I look back now, I think that was luckily just this point in time where right place, right time. So he then just initiated a referral and I commenced like screening from the age of about 26. So I had annual MRIs and mammograms. And so, I feel very thankful that I was on a path where my breast cancer could be picked up quite early. I did find a lump in my breast, and so I knew that I had a scan coming up in about 3 weeks' time, and I could sometimes find the lump and I sometimes couldn't. So I thought, I didn't think much of it. And, had the grace of being able to say, oh, yeah, I've got an MRI coming up. If it's anything, they'll find it. So I had the MRI and then was referred for an urgent ultrasound guided biopsy, which ended up being inconclusive. They couldn't biopsy because the ultrasound wasn't very definitive. So I left the ultrasound thinking, yay, it's nothing to worry about. This is great, you know. But thankfully, the radiologist was very good in that she wanted to close the loop. And she said, I think just to make sure we're happy, we need to do an MR guided biopsy. And then that's how I got my diagnosis. So it was quite, when I say prolonged, it felt prolonged because, you know, just the waiting and the waiting for each kind of step. And then, you know, I remember getting a phone call on a Friday afternoon at 4:30 to say the breast specialist would like to see you on Monday morning at 8:30. Can you please come in? And I'm like, oh, sometimes, like, I enjoy that our profession gives us a lot of knowledge and there's a lot of, you know, understanding the system is great because it takes a lot of the burden away. But then I'm like, oh, I'm not happy that I know so much that I know that if I'm getting a call to come in on a Monday, it's not necessarily going to be everything's fine. So yeah, that was really hard, that weekend of just sitting there with my thoughts and thinking, what is this going to be, and spiraling. So challenging in that I now was in a very different life stage, having kids and being a wife and having a career and all these things. So the mind went lots of places, that's for sure. And then so we were given the diagnosis. My husband was with me at the time, and I think as much as I knew what she was going to tell me, the hardest bit was probably, I think, like seeing my husband. I know that sounds weird. I think in the back of my mind, my whole life, I'd kind of almost not prepared for this, but I always knew there was a possibility. And I think when you're the patient, you're the one going through it. So you know there's steps being taken to get you where you need to go. Then you have everyone sitting on the outside. And that was really hard for me because I kind of thought, you know, how is he feeling? And I just, you know, barely trying to hold it together. And, you know, partners want to be strong for the other. It was just not a nice situation at all. So yeah, that was quite intense to go through. And then I think probably the hardest part of all of that, and I don't think I'm alone in this by any stretch, was just the waiting. Once I knew that I had a plan and I knew what needed to happen, it was just this period of waiting and trying to just carry on with normal life. And it was, you know, this time of year. So for us here in New Zealand, it's summer and getting ready for Christmas, and the kids are finishing school and everyone's in a great mood, which was nice because in some ways it was a good distraction. But then on the other hand, it was very, very lonely because I didn't tell lots of people immediately. I needed just time to process it. And yeah, I look back at that time and I think there were so many great things that we did at that time. But there was always this underlying kind of weight that I'm just walking around with this breast cancer that I just want gone so I can move on. Yeah, hard. And then, you know, just the general conversations when people come up and they say, what are your plans for the summer? And, you know, those kinds of things, which no one really teaches you how to answer those kinds of things. And yeah, so very, very different, I have to say. Very different.
Can I ask Jess how...
Lots of talking.
No, it's really powerful to hear it. And I think you've probably touched on every angle of mental health side and conversations and things that lots of people talk to us on Rad Chat about. I think patients and carers, the dynamic is very different. As you said, lots of patients I'm sure we've seen in radiotherapy, radiation therapy, they're in it, they just want to get on with it, take their medications, go home, have a sleep. Whereas the family are the ones who are like rallying, what do I need to cook? How do I need to get there? I need to think about all these other things. And it's quite difficult for people to put those thoughts together. How has your husband kind of coped with it now, I guess?
Yeah, I think, you know, like with my treatment, I was very lucky that I was found early and I chose to be radical with my approach. I always knew that if this was a possibility that I wanted to have a bilateral mastectomy. So I was lucky that I could have that and a reconstruction at the same time. So it was a really big surgery, obviously, and all the anxiety going into it was very palpable in our house, without a doubt. And then I think the nice part of it was that the healing and the recovery is so, once you're physically recovered, for me, that was the hard part, because I'm such an active person. To just see me not be able to do anything, that was challenging, because he then carries the weight of everything, all the responsibility, the kids, everything, feeding me, helping me shower, helping me get out of bed, helping me roll over, all that stuff. So it's a lot for them. But I think, we're very good with our communication. We talked about a lot of stuff. And, I think that now we're in a good place, but there's definitely still times and things that trigger off those moments. I'm not even a year post-surgery, and I recently had some more surgery for like corrective stuff. And just that whole like going back into the hospital again, I think for both of us, we realized, oh wow, this is still a thing, because all those feelings came back again of, the last time, even though this was for something that was maybe a bit more positive, or not so traumatic. But yeah, it's very different.
It's so interesting to hear you kind of articulate just those psychological emotions that we know patients experience, but
Yeah,
also being an RTT as well. I
yeah,
think you kind of know what to expect. You know a lot of information, and I don't always necessarily know that's a good thing or a
yeah,
bad thing. It's hard, isn't it?
100%.
Jess, did
Yeah.
it change you as an RTT? Do you see things differently because you've had cancer, not just once but
Yeah,
twice?
I just got goosebumps when you said that, Joe, because I think I'm actually quite, like, sometimes a little bit speechless at how much it's changed my perspective and things. And I want to say these things with sensitivity, but as a radiation therapist, I think we'd struggle to find anyone that does the profession that doesn't have a caring nature. They got into it because of people, and how much they enjoy being around people or looking after people, either one of those. And I think throughout your career, you change your opinions of what you love the most about your job. For me, it was always the patients, without a doubt. Like, I can't pick any other part of the profession that I liked more. But I know when I look back at what I did in my career, you develop a sense of complacency in terms of what you think the level of care is that you're providing, and then what the patient actually sees. And yeah, there's been some moments, because obviously I'm no longer clinical and I'm with Elekta, but I spend quite a lot of time in departments. And there's been a couple of incidences where I have had to catch myself from wanting to say things. It's not that I don't want to say it because I don't believe it to be true. It's just, Jess, it's not the time and the place to say this. And it's just little things, like, I think sometimes we get so caught up in the technology that, everything's moving at a fast pace. Everything's going quickly. We want things faster, more efficient. We want this, we want that. And for good reason. I sometimes get the feeling when I'm around people in the clinic or certain situations, I'm like, I don't want that to overtake actually what you're here for as the patient. And so I feel like a real inner turmoil about that quite a lot these days, I think, about, you know, shorter fractionations mean we've got less and less opportunity to develop a relationship and make people feel comfortable. And it doesn't have to be big, overt things. It's just the small, tiny little things that make people actually feel like human, not just laying on a bed in a big cold room with cameras glaring at you. So it has changed me. I don't think if I went back to the clinic, what would it change about my practice? I think I'd probably just be more aware and more present. But I think it's just good to take stock of, what's actually important.
I would imagine for any RTTs, therapeutic radiographers listening around the world, they can maybe reflect upon their practice about potentially their obsession around accuracy, reproducibility, waiting times. I
Yeah,
certainly know from my own experience and from working clinically, and also, talking to colleagues who are still working day in, day out with long waiting lists, knowing that the less the less time they spend with patients and the quicker they get them through, the more
Yeah,
patients they'll be able
that's
to treat.
right.
And it's
Absolutely.
such a confliction, isn't it? Because you
Yeah,
are constantly thinking, gosh, we've got this many patients in a day to treat. And sometimes I just think, but the impact the other end is something that a lot of RTTs don't get to necessarily see. And I
yeah,
certainly never ever appreciated, and it's only through doing Rad Chat that we get to hear from so many patients now who afterwards have lots of questions, don't really know what they've gone
absolutely.
through, don't even realise why they've had radiotherapy, even though they've gone through the whole consent, the whole treatment, they will still contact us going, why have
Yeah.
I had to have radiotherapy?
Do you
You
know,
know,
yeah,
it's really eye-opening, I think.
yeah. I even found that after just having my mastectomy, it wasn't until after everything had happened. Well, one, it all caught up with me emotionally, and well, what was that? But two, it was then I was afterwards, I was like, what were my other options? But not really. But, like, because you put your trust in the professional. My surgeon straight out said to me, you're a perfect candidate for this treatment. And I was like, great, cool, let's do it. Never once did it occur to me to say, well, was there something else? Why, it's just, it actually has opened my eyes into how much, like, breast cancer just in itself is such a complex disease. And I probably never really appreciated that as a radiation therapist until now. Um, because I think we look at, you know, um, the patient, so we're so focused on them when they're with us. And then we also know, you've got a great outcome based on what your tumor staging is, but you forget about all the other life that happens and all the other things that those women or whoever are going through in their life. And then you throw in their hormone therapy, and that's a whole other fun kettle of fish. Yeah, it's just so multifaceted, and just it has really opened my eyes also to just how individual all of our treatments are. And we know that as RTs, but like a really good friend of mine, a colleague, actually was diagnosed not long after me, and her whole journey has just been like, well, I feel very thankful, and you're constantly comparing, like, gosh, I'm so lucky, and look at, she's had to go through that, but it doesn't necessarily mean that what I went through wasn't hard, but it's just so different for everybody, and that's been heightened, I think, for me, and the people that I've met along the way, and in different groups and things, and yeah, it's just such a complex thing.
Jess, I know at the beginning you said you felt nervous because it's a bit like an interview, so I've got a little bit of an interview question.
Okay,
A
go for
three-part
it.
one. Obviously, you've been very honest and sharing your reflections of your two cancer diagnosis. What's the best interaction you've had with a healthcare professional? What's the worst one you've
That's a
had?
good one.
And what would you change? One thing of each.
Yeah, such a good question. I've actually got I've got plenty of good interactions, but two that have stood out to me for different reasons. One was when I was having my MR guided biopsy. Well, that's an experience in itself. So I like to explain it, obviously, like battleships on your boob. It's about laying prone for 2 hours. I mean, so much fun, and then squishing your boob, and they explain it like battleships. And so great. It was a great explanation for me. I was just more interested, and I wish I could watch the procedure because it just sounded so interesting, but I couldn't. Anyway, didn't go as smoothly as I'd hoped because of the location of the lump, and they had to go, all these different angles, and I was laying there for 2 hours, and it's just small things when you're in that situation, like, because you're just really alone with your thoughts and hearing their talk, and like little things like the radiographers just always coming and putting their hand on your back and just saying you're doing really well. Like, I know we do that as RTs, and I know that it's just so, but man, like, I just feel like my whole body would just kind of like just relax when you feel that like little human connection. And it's never really occurred to me in any other instance except for that one, because clearly I was maybe a bit more on edge, and also the uncertainty. And I I reflect on that and I think, and this is maybe like a profession joke that, whenever people say, what do you do? And you say you're a radiation therapist, like, oh, you take x-rays. It's like, no, I don't, But I think like to give them their due, diagnostic radiographers are looking after people at like the most vulnerable part of their journey when everything's unknown, and it never really occurred to me until it was me there again. And so that for me was, yeah, I think important because it just goes to show that it's those tiny human interactions that can make the world of difference to how a person feels. So that's one of them. And the other one was when I first sat with my medical oncologist to talk about options after my surgery. And I knew her because I'd worked with her previously, and she's lovely and so nice. And she sat and she said, look, I'm going to just talk to you as if you've never worked in anything to do with oncology, which I was happy about because I purposefully did no reading. So she went through everything. No, it was before that. She sat down, did the introductions, who she was, and said she was going to do that. And then the very first thing she did after that was turn to my husband and say, and how are you? And she's the first and only medical professional to really acknowledge him and genuinely ask how he's coping with things. And I just you can't underestimate the value of that. I don't know. For me, it was huge, and that's really stuck with me. And it was important for him too, I think, because, so often they sit there and just listen and just like another body in the room. And yeah, so that was really special. And then what was the other thing I had to,
Kind of don't want to ask, but something negative and something you would change.
Yeah, something a little bit negative. When I was in hospital recovering from my mastectomy, I was in there for a couple of nights, so obviously through the night you have night nurses that change, and I remember one nurse coming in, and I don't know if she just hadn't read my notes or what, but she made a comment and she said, oh, so have you just decided to have your breasts off? What did she say? I don't think she realised I had cancer, let's put it that way. And the comment she made was almost as though like, oh, she hadn't realised that what I had done was because I was unwell. And it was really, I felt really like it was a little bit judged because I'm like, oh, am I going to get this all the time now? Because I have reconstructions of people just going to think, oh, she's had a boob job. I've got a good story about that too. But yeah, it was very, that kind of was enough for me to remember, I guess, and keep going back to it. And it kind of grates me because I know as therapists we do our best to know everything about patients before we interact with them, understand what we're dealing with. And so just little things like that when it makes you feel like, oh, did you even look at my notes? Do you even know why I'm here? Just felt a little bit dismissed. But yeah, I'm sure there's others, but those are the only ones that are coming to me.
No, it's really interesting because they are small things,
Yeah.
but they've made such a big impact,
Yeah.
human connection,
Yeah.
and just, stereotyping people that potentially, that unconscious bias and comments, but that make a real impact and last with people. And I think it's really important for healthcare professionals to just have that in the back of their minds.
100.
And it is hard. I certainly reflect back on things that potentially I did or said, and I think now it's cringeworthy. That I think,
no, we all do it. We all do it.
Yeah, but it is so important to just appreciate that those comments, those things that you've done, can have that lasting impact.
Yeah.
So thank you for sharing. Jess, in terms of kind of long-term side effects, other than obviously having a secondary breast cancer, have you had to cope with any other long-term side effects from radiotherapy or chemotherapy?
Yeah, so from my Hodgkin's lymphoma, I had a radiation-induced hypothyroidism. So that was diagnosed quite early on, and I just take medication for it. I've had a few like strange BCCs and things removed from kind of like, my hairline and that, which when that was another example of just, how much I feel like if you can't advocate or understand what your medical history is, it's really challenging, because at the time when I saw a specialist for those, they were really like concerned about my age and that I had these BCCs in these strange areas. And, I just said, well, I have had, mental radiation. And so, but, those little tiny things, and I don't think I'm alone in at all in my experience with healthcare organisations, and that you kind of have to be your own advocate a lot of the time, which is scary, but also again makes me thankful for the medical literacy that we all have from our professions and things. Yeah, but otherwise nothing else that I can think of. Yeah.
Obviously, being a radiation therapist and your diagnosis and stuff, how do you manage with the fear of recurrence? Because that's something we
That's a
hear a
good
lot about.
question. Because someone actually asked me after I actually did a presentation to a branch study day not too long ago, and one of the questions was, now that I talked about the fact that I had this fear of having breast cancer hanging over me my whole life, and they said, do you feel like that fear has gone now, that it's over and done with? And I was like, oh, I probably hadn't thought about that just yet. But to be fair, I think it's one of those things that I don't think it will ever go away. And certainly I have just had a appointment with a genetic counsellor to have some genetic testing done, just because, although they are 99% sure that my breast cancer was radiation induced, they could also still check to see. I was only 39 when I was diagnosed, and although I don't have any family history, it might just be interesting to know. And so that raises all those questions, as well as if they do find something and you're predisposed to X, Y, or Z, how will you feel? And I just think it's just knowledge is power in a lot of ways. So I think, having that is, yeah, okay, it's still a fear of mine, but I just try and do what I can to live a healthy and good life now. I don't feel like I can continue to live in fear for my whole life, because it's just, yeah. It doesn't go away though, especially when it comes to those times of the year when everything happened, or all those little anniversaries that never quite go away, or, yeah. I don't know if I answered your question.
No, you absolutely did. But also as well, I think it's, again, important for us to recognise just that when you get a cancer diagnosis and you hear those words, you are changed forever. You always have. I always describe it, and, I know that prognostically my cancer was, really, my outcomes were really good. But still, when you put the washing in the washing machine and it's in there,
yeah,
and you've got to get it out, but for whatever reason you think, oh, I've got to go and walk the dog, I've got to go and sort out the dinner, but always in the back of your mind you're like, that washing is still in the washing machine. And I know that for some people listening, they may think, well, that's really trivializing what cancer is, but it is always having that one thing in the back of your mind that you just go, that headache or that lump,
absolutely.
It is just something that you always overthink, I think.
Yeah, and it's funny because my mum has said to me once before, she's like, oh, your whole life is about cancer. And I'm like, well, no, she doesn't mean it in a bad way, but I trained or had cancer and then trained as a radiation therapist. I work in oncology, and I, when I spent a lot of time volunteering for a charity called Camp Quality. I don't know if you guys have it in the UK. It's for young children that have had cancer, and and I'm like, yeah, okay, but it's not catchy, Mum. I'm not going to catch it from somebody. Yeah, I don't know. It is. I will say though, as much as I knew that there was always that, risk for me in the back of my mind, I definitely went through down the spiral of well, why the heck did I have to be the one that got it again? Why couldn't I be in the percentage that didn't, you know? So you definitely, that whole roller coaster of emotions really surprised me, because I feel like, oh, I'm doing exactly what the textbooks tell us that patients go through. You know, it was a ride, and it still is, like, somewhat. And with like hormone, like with tamoxifen, sorry, I can't even say the word. Living on that is a ride in itself. Yeah.
Yes, what do you do for Elekta now?
So I'm an account manager for New Zealand. So I look after all the customer install base here in New Zealand, which is great. I actually started with Elekta in software support. So I did that, and then the previous account manager for New Zealand kind of said, I think you'd be good at this. And I was like, I don't know that I'm interested in that. But she's like, what have you got to lose? Give it a go. And yeah, I really don't look back. I love the interaction with people that obviously I've known for a long time. New Zealand's a very small place, and we have one university that trains radiation therapy students. So we're a small, tiny profession, but yeah, a great little part of the world to look after. Yeah.
Beautiful. I do remember, I can't remember where we were, Naman, where we were watching a speaker who comes from New Zealand, and they were showing lots of imagery. And I was just like,
You'll have to come.
move.
Yes. Maybe we should get you down
Thanks,
here
Jess.
for one
If
of
you
our
could,
conferences.
Yeah, send the Elekta jet over.
Yeah, I might. I'm gonna look into that.
Brad Chat on tour does
Yeah,
New Zealand.
absolutely.
We would love that. We would love that.
Yeah.
Jess, in terms of kind of your work with Elekta,
Yes.
do you kind of impart your knowledge of being a cancer patient on things that they're doing at Elekta? Because I think, again, that's so important, isn't it? Is bringing together the clinical sector, industry,
100%.
patient perspectives.
I think my passion for my job and my passion to represent I say customers, I feel weird calling them that, but obviously you know what I'm talking about, is reflected in how I advocate for them and what they want. I know I'm just a small fish in a big ocean, but especially in Australia and New Zealand, I think one of the key roles of all of us in those positions is to really be the voice of customers, because, you know, it's one thing for big organizations to be able to get out there and see what customers want, but sometimes in this little part of the world we get forgotten. And yeah, I think that's something that I'm very passionate about, is making sure that what our people on the ground are saying is heard. And I think probably in terms of my patient experience, it comes out sometimes maybe unexpectedly. I had an example the other day, and it was actually with a customer, because you know, we all have things that we desire in radiation therapy in terms of equipment or what we'd like to see. And one of the comments was about the speed of gantries going, you know, why can't they just go really fast and this, that, and the other thing? And it would just be good. And I just said, but would the patient like that? I don't think I would. You know, like, so I feel like I have that kind of rapport with most of the customers I deal with. I feel that, like, a lot of them I'm very close with, and I can be quite honest like that. So I'm happy to challenge those types of opinions, whether I'm right in doing so in my Elekta hat, but I do feel passionately about it. Like, at the end of the day, it's patients that we should be focusing on. So that's a wee example, maybe.
I think it's good because that's what your company would want, right?
Yeah.
I think if I work for the NHS, it's clearly about patients. I work for a charity, it's clearly about patients. That's what's important. And I'm sure your clients would see it as a benefit. Clients, customers, as a benefit as opposed to anything else. And it's probably nice that you can be like, what about the patient?
Yeah,
I think anytime we go to Estro or, you know, big conferences and stuff, we hear about this amazing innovation, but you just think, is the patient going to like that? And I think that's something, when you talked about hyperfractionation, there's definitely something at the minute. I'm just like, but I want to see my patients. We don't get enough reviews anymore with patients anyway. And when they're finished, especially people who have breast radiotherapy, 5 fractions, it's the 2-3 weeks afterwards that it hits them. You know, they've gone from surgery to 5 fractions and then done. They don't even get a follow-up sometimes. There's just your next mammogram, that's it.
It blows my mind. I think it's such a different profession to when I trained, you know. It's not a different profession, but yeah, the patient care element it's not disappearing, but it is becoming so much more challenging because of where things are now. But even it's little things like, this is another example of my role in Elekta and then someone making a comment, and you know, it's very well known, you know, for an Elekta machine you need to go into the room to push the XVI out of the way. And I get that that's an efficiency thing, and I wholeheartedly understand where people come from when they talk about, you know, the challenges faced with that. But then the other side of me is like, you know, see that as a moment to connect with a patient that's laying on the bed in a big empty room for 10 minutes of your day, and all you need to do is just say to that patient, you're doing really well. Touch them on the foot. Don't even touch them if you don't want to, but just those little moments or those opportunities for connection, you might not see as important, but for that person, they're going to remember this for the rest of their life. And laying there in a big open room with a machine moving around it and you not talking to them except for through a microphone, I know that sounds quite harsh, but it's just little things like that where I'm like, oh, but it's a chance for you to make them feel like they're okay. That was something that I remember. I recently worked with someone to like review some patient education information for AYA, people going through radiation therapy, etc. And she asked me about my experiences as a 15-year-old, and I said, you know, one of the things, what do we say so often? Nice and still, nice and still. So as if you're laying there, nice and still, okay, I'm nice and still. Am I nice and still enough? Oh no, I think I moved. But those little things like, you're doing really well. Oh, okay, I'm fine. I didn't just, you know, ruin my treatment. And I know it's so simple, but it's just, yeah, those are the things that have probably been a lot more heightened for me since having the opportunity to reflect back in the last 20-something years of my life.
Jess, I think Elekta are very lucky to have you, because when you're talking about being an RTT, you are so passionate about it. So they are very lucky that they got you.
Thanks, Jo. Thank you.
Jess, we're coming to the end of the episode. We always like to end with top tips. As you've already said, you're a super fan. You knew this was coming. Do you have any other top tips for our listeners, please?
Yeah, I think one of the things out of everything that I would say to maybe people in the profession or people entering the profession or those that have been there for a long time is that, like, it's quite easy to feel like, you know, you see so many patients day in, day out. I think one of the things, and I think we all know this, but we should remind ourselves maybe a little more often, is you might not remember every single patient that you see or treat or interact with, but they will always remember you and the way you interacted with them. So, you know, even if it's just one little thing you do to make them feel good, or even unfortunately if you do it bad, they'll hold on to that for the rest of their lives. Yeah, I think if we just go into interactions with people remembering that, I mean, you don't have to change every single person's life, it's just the little things, I think. Yeah, that
amazing.
would be it.
Thank you so much for coming on. It's been a very powerful episode.
Thanks, guys. Really appreciate it. I feel a little bit starstruck.
No, not at all. Thanks for being our first guest from New Zealand as well.
Yeah, am I the first from New Zealand? I might need to get onto that and just sort some.
Yeah, maybe we'll send you a certificate.
Thank you.
Or maybe a Rad Chat t-shirt, a duvet cover, something.
Not with the postal prices these days, Never. We don't have any money.
Good point. We'll see if anyone's flying that way soon.
Especially, yeah.
Well, yeah, thanks everyone for listening to Rad Chat with me, Julka-Anderson and Jo McNamara. So our next guest to feature will be Annie Prescott as part of our Education and Workforce Development series, talking about brachytherapy education in therapeutic radiography. So thanks all for listening and take care. You can use this episode as part of our free continual professional development accredited content, which offers flexible learning that fits your busy schedule. Just check out the show notes for the reflective questions, links to literature and resources, and a link to complete the form to receive your accredited certificate.
Stay up to date with the latest radiotherapy and oncology advancements by liking and following us on social media channels and hitting subscribe wherever you get your podcasts.
Join a supportive community designed by professionals who understand the unique challenges of radiotherapy and oncology. Check out our website www.radchat.co.uk. Together, we're actively working to improve our profession and make a lasting positive impact on cancer care.
It goes without saying that we can't achieve this alone. It takes all of us working together to create real change. That's why we value every voice and every contribution. We ask that you listen and learn, spread the word, share your story, and if you need to, contact us.
If you like what we're doing, buy us a coffee, keep us caffeinated, go to our website to find out more. Thank you all for listening and take care.